Welcome to MD-Esti Bestie. I am Dr. Lynn Nieman, board-certified anesthesiologist, but I guess owner, operator, founder, partner now with our sister practice in Leesburg. But we are newly rebranded, refined at Blossom, and this is my Esti Bestie, Tracie Barnes, who is master of all things. And we have a topic for you today that's really about fillers and biostimulators and filler fatigue. And is the filler era dying and what's replacing it? And we're going to kind of flip the tables a little bit today. And Tracie's going to be asking some more of the questions.
Yeah.
And secretly, she's terrified to be asking more of the questions. But actually, I'm going to hand it over.
I think we're on this side a little bit better because when you
sometimes should we need to
I'm just saying, like, when you're asking, sometimes I give you the deer in the headlight look. I don't know what we're going to be covering. Okay. Mm-hmm. So let me start by asking the difference. I want you to explain it to everyone, the difference between HA filler versus biostimulator, which would be your Sculptra or your Radiesse.
Mm-hmm. So, we have different tools in our toolbox, and they don't all do the same job. When people start coming in and they want to talk about kind of rejuvenating their face, like a lot of people automatically think of HA fillers. And an HA filler is a gel-based filler. It's got hyaluronic acid and usually some water and a little bit of a numbing medicine inside, usually lidocaine. Some companies use mepivacaine. And that is going to help to give lift and volume to a certain area. So that's adding volume. So our HA fillers can add volume. So they can do so in a way that's going to add more lift, in a way that's stretchier and softer, but they add volume. Our biostimulators rely on our body's own response to that biostimulator. And the job of a biostimulator is truly to act on a specific cell to do a job. So in a bucket, that's what biostimulator means. But for our purposes, for the kinds of medications that we use, typically our biostimulators are FDA-approved biostimulators, are Sculptra and Radiesse. Now, those both act through a slightly different pathway, and we'll get into that a little bit more. But they do the same thing where they ask your body to upregulate from the fibroblast more production of collagen. It's typically type 1 and type 3 collagen. So our fillers fill and add volume. Our biostimulators give a signal to our body to do a job. And those specific biostimulators are stimulating our bodies to make more collagen. And so that's the difference between the two. And they both do a beautiful job. And if you use one, it doesn't mean you can't use the other. They play really nicely together in the playground. And so you can use them together to achieve a certain result for a patient.
Okay. So if someone comes in and they're asking the difference in what they should get. So maybe they were thinking filler, but when you're looking at them, you're thinking, well, maybe Sculptra. What are you looking for, and what would make you say no to the filler, but yes to the Sculptra, or vice versa?
Gotcha. So in my mind, and the way that I think about this, the way that I structure my consultation to a patient, and also the way that I assess a patient, is I am looking at certain criteria for treatment. And when I have someone who is coming into my clinic who's had global volume loss, so they've lost volume in multiple different areas, what I want to do is create a strong foundation first. So kind of like if you were building a house, like Tracie's just moving, and she's been like moving, and poor thing's been moving boxes and everything. But when you're building your new house, the first decision you make is not the curtains you hang and the throw pillows, right? You've got to build a strong foundation of the house first. And so the way that I think about our biostimulators is building that foundation of the house. And the idea there is if you have maximized or optimized your collagen, you have optimized just some of the skin strength and integrity that you have, and you are maximizing what your body's doing on its own, you can fine tune behind it with some filler. Now, if you've had global volume loss, there may be areas that are going to be very appropriately treated with filler. But I find that if you do that fine tuning, that sort of structural improvement first, you can use less of your HA filler. And that can give you a very nice result. I find that most of the patients who are coming in now, who are still very open to filler treatments, the one thing that I hear over and over again are people who are worried about looking unnatural with their results. And there is a really fine line. People tell me this all the time, and it's threading the needle, right? I want to see a difference, and I want to feel like I'm getting my money's worth, right? That I can look in the mirror and I see that I've paid for something that I can visibly see, but I don't want anybody else to know. And I may or may not want my spouse to know, but I don't want anyone to ask me what I've done, but I want them to think that I look better. And I don't want to have any downtime or swelling. And at the same time, I want to feel like I look like I felt 5 years ago, 10 years ago.
Right.
So it's a very interesting needle to have to thread sometimes as a provider. But also it's when we do knock it out of the park for someone, it's really satisfying when you're like, when they say, like my husband didn't notice that I did something, but he kept telling me that like I looked really great.
Yeah.
And so those are some really kind of interesting things, but it is really threading a needle sometimes because I don't want people to structurally look tremendously different. I want to work with integrity to their own tissues and their own beauty and keep them looking natural.
Sure. So do you think a lot of that comes from social media where people have maybe overfilled and then people are seeing that and they're like, I don't want that?
Yeah.
Do you think that's
where that stems from? I think there's, yes, there is a lot of information that we get from social media. So around the time of the pandemic, that when people were doing all their Zoom meetings, right? And while they were doing their Zoom meetings and they're looking at themselves on camera, and one of the funny statistics I read is that 80% of the time people are on a Zoom meeting, they're watching themselves.
Yes.
Right?
Yes.
And so we spent a lot of time watching ourselves, and people started to think, oh, I look angry, I look upset, I look tired. And that really got people interested in Botox. And I think that there's been just such a boom in social media since then, right? Since the pandemic, TikTok, Instagram, all of that. And there's a lot of information out there. And so I think that as people came out of the pandemic and they were looking for aesthetic treatments, and they were also influenced by the Kardashians or kind of what was going on in that social conversation at the time, people started doing more and more filler treatments, or we're looking for med spas where they can go and almost like order off of a menu, right? Like,
yes,
I want the cheeks, or I want the chin, or I want something else. And I think as injectors, even we were trained maybe a little to look at things a little bit differently back in 2019 than we would train injectors and, either PAs, NPs, MDs, RNs who are doing injectables today. Even just the thought of treating the face is a little bit different. And so I think it's like a confluence of many things. So social media, for sure. And we know there's a real Instagram face. When I say that, you can picture in your mind what that was. In large part, a response to filters that people were using. But those filters and Facetune, if you can think back a couple of years, really created these contours that were almost duplicated from person to person to person. And our brains started to read those as normal. And people were coming into the aesthetic space wanting to look more like filters and wanting to look like their online version of themselves than to look like their actual self. So I think that our brains really did get used to seeing that as normal. And there was an uptick in filler treatments. And over the past couple of years, there has been a lot of talk, I think, in a social dialogue about people who are reversing all of their fillers. Or we saw celebrities who had maybe wanting to avoid a facelift had maybe done too much with filler. And we all thought that something just looked off there. I have made a point to never put a screen of a celebrity or someone behind me and talk about, I'm not their doctor, I didn't do their treatment. So I'm not going to name any particular celebrities now and say like, but I think we all know, we have that cultural knowledge, right? Of those women who maybe we were all like, like doesn't quite look like herself, or maybe things look a little puffy, and then 6 months later that we see that same person and we're like, oh no, that looks normal again. And so there really came about this discussion of dissolving fillers, and then fillers really became like persona non grata, and like in the enemy number one. And I think that pendulum has swung in that direction, but I caution people, it's not the filler's fault.
Right.
It was the person who had the filler in their hands, who was using that to solve all of the, aging concerns or aesthetic concerns that a patient had, and maybe not choosing from a more full toolbox with other tools that could address some of the concerns. But then also, I think this comes back to what we know about anatomy. There are so many amazing people. I'm going to say Sebastian Codofano, Dr. Surik, Sarah Safa, and Dr. Lee Walker, so many people who have done such an amazing job of really teaching people anatomy. But I think that, again, like 5 years ago, when we were thinking about anatomy and injectables, we were learning a part of the face, like cheeks or jawline. And now we think of things as how do the cheeks connect to the temple? How does the cheek connect to the submalar area? How does the cheek connect to the under eye and the nasolabial fold? How does that all connect with what we see, that preauricular space? And how do we make that whole thing look beautiful and rejuvenated? And we think of them less as individual parts because we want that whole face to look, beautified and rejuvenated. And so I think there's a real mind shift difference in how we're using fillers this day. So did things go overboard? I would say yes. I would say in someone who maybe hasn't kept up with their education or hasn't really gone back and retrained or kept thinking about, well, how do I get my best results for the patient? Maybe they keep reaching for the filler over and over again. And you know this because you've been in the room with me, but I always I feel very much protective of my patients. And sometimes I'll inherit patients who have seen other people for a while. And someone will say to me, I had an injector and she told me that my lip filler is going to last for about 6 months, right? And then every 6 months I went back and got more lip filler. And now I feel like I don't have any definition. I feel like I have migration. It was like, yes, because your filler lasted way longer than 6 months. Right. And nobody needed to be giving you filler every 6 months. We should be treating for a clinical reason and not treating just because the clock said filler is time to redo that filler. And what I will say, I do want people to, whether you're in aesthetics or you are a person who's potentially a patient, the FDA studies are some of our FDA studies and that give us the duration of time that our fillers last. Mm-hmm. They will study a filler to show that there's clinical evidence of that filler up until a certain point, right? Right. So we're doing that study on, let's say Volbella, and which is a Juvederm product, and let's say on label Volbella is 6 to 9 months or so. That doesn't mean that they continued the study at 36 months, right? Yes. They did the study to show the efficacy and that it was there to a certain number of months, but they didn't do that. They didn't keep going, right? And so I think what the mistake that we make is thinking that the time duration on a filler product is the amount of time it's going to last in everyone. It's not. It's telling you kind of a minimum duration that you can expect to see, but fillers last a long time. Do I think that that's a bad thing? I don't think that's a bad thing. I think fillers lasting a long time is a really great thing. Sure. But that's why your clinician needs to have a really clear way to assess the face, to diagnose what the problem is, and to treat for their diagnoses. So they need treatment criteria and not just Tracie came in and asked for cheek filler today. Right. That's not a treatment criteria. Maybe we need to get to the bottom of, why do you feel like you need cheek filler? Do you feel like your under eyes are dark? Do you feel like your face is kind of falling or it's not lifted, and you come in and you ask for cheek filler? My job is to diagnose, assess, and look at the criteria for treatment and then come up with a treatment plan for you. And so I think there's a real danger in people coming in and like treating it like a gumball machine, right? Like,
oh, yeah.
Today I want the cheeks, today I want the lips, today I'd like the chin. Gone are those days, and they should be gone. And if your injector is somebody who allows you to come in and just tell them what you want, then you might want to just have a fresh assessment with somebody else who's got fresh eyes and can maybe steer you in a way that's going to keep things looking beautiful for you over time. I think of filler patients in two ways, or even, like assessment patients in two ways. There's restoration and then there's beautification. So in our younger patients who maybe we're treating some imbalances or we're treating some asymmetries or things like that, those are different criteria for treatment. And then somebody who's had facial aging, whether they're starting to age or whether they've had significant aging, that's kind of a different process of where we're stacking procedures together. But it's in that artful stacking and combining things really strategically that's going to keep someone looking like themselves and natural over time.
That's right. I could listen to you all day. I just gaze at you like,
oh, love to like her. Thank you so much. Hang on one second. You have an eyelash right here, and I just don't want. Okay, perfect.
Make a wish.
Okay, we did.
So then, do you think that some injectors, I'm assuming, like they're not trained in Sculptra or biostimulators, so they should, where should they go for those?
Yeah, I think that there are some injectors who don't love to use biostimulators, and that's perfectly fine. As a provider, whatever your degree is, you should only be doing what you're really comfortable treating a patient with. And if you are not someone who's comfortable using biostimulators, find someone in your network who is. We have patients who will be sent to us here at Refined at Blossom from other providers who don't do biostimulators. We do their biostimulators, and I send them back on their merry way, and they get their Botox or they get whatever else they were getting with that other provider. So it's working in a team. It's like any other field of medicine. Like your internist might say that you need to see a cardiologist, right? And they send you to somebody who specializes in that area, and then you go back for your other general care. I think that that's a really reasonable thing to do. So if your provider is not someone who is comfortable providing a biostimulator, they probably have someone in their trusted network of people that they would send you to. And that might be the best way to find a provider, especially if you have a great relationship with your aesthetic provider anyway, to ask them who they would go to for their Sculptra or their Radiesse.
Yeah.
And there are people who just do a much higher volume of those. And if I were the patient, I'd want the person who has those products in their hands all the time.
Sure.
And not somebody who does Sculptra once a month.
Yeah, so that's a good point. I love that. What do you think about when people come in and they sit in your chair and they want Sculptra, which I love, filler, whatever, but they're looking for that to change, even skin and everything. But, they have to do their part at home with skincare, is how I would say. So well, what do you say to them when they're sitting there and they're like, I want this, 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 but yet you need a little bit of education about what skincare you're using?
So we, by and large, our consultation with a new patient is about an hour. And believe it or not, I feel like sometimes an hour isn't enough time to go over everything. And you know this because I'll send patients to you to have like a full skincare consultation after having a consultation with me about kind of a treatment planning. And so I will preface this all by saying when someone comes in and we're building a larger plan, maybe it's somebody in their late 40s or 50s, they've never done any aesthetics before, and they're coming in and they've got multiple concerns. They've got some pigmentation that they don't like. Their skin feels dry. They're going through some hormonal changes so that now they've got skin laxity or crepey skin that they haven't had before. And they also are suffering from volume loss and they look tired under their eyes and they feel like they're developing jowls. And I have a couple of things in my talk track that I say over and over again. This didn't happen in a day. So we're not going to make this all better today.
Sure.
And also, I will give people a realistic time. I'll say, give me 6 months, give me 9 months. We're going to build a plan and we're going to make our plan address each of those things, but we can't address all of those things at once. And so I think that that's really important. And especially if somebody, hopefully patients who come in to see me and we invest that time in the consultation and we go through treatment planning, I hope that they are willing to invest time with me to get them to those results, because I know that doing things slowly over time are going to give people a really beautiful and natural result. Mm-hmm. Trying to change, 4 or 5 decades, 6 decades of aging in one visit, I think leads to exaggerated results as well. I don't think those lead to the most beautiful of results. So again, I start things off by saying it took us a while to get here. So we're not going to change it all in one day. And I give people a realistic time frame, 6 months, 9 months, 1 year. We're going to look at pictures. We're going to look at pictures 6 months from now. And almost always when I say that and people come and they look at pictures 6 months from now, they'll say to me, I didn't know that I could see much change. And now I see those pictures. And yes, now I see that it took us, that I love where we've gone to. And sometimes with that perception drift, you don't get to appreciate it every day. But when you see that 6 months apart, you can really appreciate where you've been. I know that you are so good in your talk track about saying 80% of what happens with skincare happens at home. And so I think it is important that we get people on efficacious skincare. We've got, it's funny, today I threw out my hero. I do have hero products. Yeah. And so we've got great hero products. I love our medical grade skincare, but if I'm going to pull out my heroes for everyone today. So without a doubt, Plated Intense hero products. I would recommend that to anyone. Mm-hmm. The Plated Eye and Zeo Growth Factor Eye, hero products, qualitatively different than other eye serums on the market. Can you find something close to it? My answer is no. You have to purchase one of those 2 products. They are unique in the market. Mm-hmm. Daily Power Defense by Zeo, I think is phenomenal. I think it is their cornerstone of every treatment regimen in Zeo Skincare relies on that Daily Power Defense. And I think that there is no other product like it on the market. It's tremendous. And the Ourselves Advanced Regenerative Serum is outstanding. I would say the Elastin Hydrogen, I know you have different opinions on those. Great.
That's okay.
But I think it's phenomenal. Those are my hero products. Mm-hmm. So we've got a whole wall of things, but if I were on a desert island, mm-hmm. those are I'm taking and just keep shipping them to me. Right. And other things I can kind of know growth. I know growth factor.
I was going to say, what's mine on the desert now? What would I want?
She would want growth factor.
Growth factor by Zeo, hands down.
Yeah, I know the growth factor, and probably growth factor neck. I think you like as well, but So growth factor serum I know is yours, but you have to be on efficacious skincare at home. If you are in one of the conversation starters for me as well is, where are you with your hormones? Mm-hmm. Are you perimenopausal? Are you menopausal? Are you postmenopausal? But menopausal, have you talked to your GYN about hormone replacement therapy? Are you on hormone replacement therapy? We've said this before on our podcast. I am shocked that I am the first person to be having this conversation with so many women who come in with complaints about laxity in their skin. And I say, are you on hormone replacement? And they tell me, no, should I be? And so we send patients off, but we can only do so much with our treatments here if we're not treating the root cause, right?
Right.
And so some of our root cause is making sure that we get those great hormone benefits that we can get in the right patient. So making sure that your HRT, HRT needs are being addressed.
It's huge.
And it's massive and it's huge. And it's something, if you are a provider and you are not asking those questions, you should be asking those questions. Diet, nutrition, and exercise. Yeah. It's all part of your overall health. It's all part of your overall well-being. And so we need to address those things as well in our assessment. Sunscreen, sun exposure, just lifestyle, smoking, things like that. If you're still smoking and you're coming in and complaining of the way that your skin looks around your mouth, there's only so much I can do.
Right.
So we have to be having those conversations with our patients. And then we have to come up with a reliable plan. And the plan can be, the plan can expand and contract based on what a patient is willing to invest in. But that plan is going to be looking at all the layers. So you asked me, if I'm getting back to your question, which is how do you build a plan for someone? What do you tell them? So number one, we didn't get there today. Number 2, I'm going to set out a time frame and expectation. Number 3, I'm going to talk about all those other lifestyle and medical factors that can be contributing to their chief complaint why they're there. Number 4, I've got a picture of a cake on my wall. We don't have it behind me. I don't know. We can maybe add that in.
Yeah, I love it.
And the cake is a metaphor that I borrowed. The first time I heard that cake explanation actually came from Erica Berry. And I've really taken that and made it my own. We have a picture in the room with each of the layers cut, just labeled, but also what products really affect each layer. So our skin, it can be our Sculptra, our hyperdilute Radiesse, our skincare at home, our laser treatments, microneedling, things like that. Our subcutaneous layer, that's going to be so deep dermal, superficial subcutaneous. You're going to get a little boost from your Sculptra there, potentially your Radiesse, but then your fillers are going to be in that layer. Our muscle layer, which is the next layer down on the cake, that's your Botox. Yep. Right? Unless you're doing really intradermal Botox for like pore size, things like that. That'll hit layer 1. Otherwise, layer 3, that's what we're treating. So someone who's been doing Botox their whole life, someone comes in, and I do have patients like this who are maybe in their 60s and 70s, and they've been doing Botox their whole life, but they're not happy with volume and things like that. And they say, I've been doing Botox my whole life. You've only been treating one layer of your cake. Yeah. Your whole life, you've neglected all the rest of the cake. And that's the reason why there could be additional improvements if we're willing to treat other layers of the cake. And then our deep fat pad layer is that lowest layer of our fluffy cake, which just changes in its height and ability to kind of lift that whole cake over time. And then the little cake stand that our cake sits on represents our bone, and we've got bony reabsorption over time. So we talk about those things in our consultation, and we talk about why each layer is important and where each layer is having some changes over time. It's based on aging and time, and then your own individual anatomy and the tools that we have to treat each layer. Now, sometimes it feels like more when we do things that way instead of just saying like, hey, let's do some Botox. Right. Hey, let's do some filler. Yeah. But the reason why it's important to discuss that is because, again, this goes back to I should have a diagnosis. I should have treatment criteria. And the thing that I'm offering you should be to treat one of the areas where you are going to get a benefit in the end. And so I need to know what I'm treating. Yes. What layer of the cake am I treating? What am I doing to get you the benefit that you want, to get you the result you want? Can I treat any one of those layers with just one product? Can I treat all of those layers with one product? The answer is no. And so that's why when I come up with a treatment plan, it is usually going to include some neurotoxin. It's usually going to include some filler. It's usually going to include a little bit of Sculptra. It's usually going to include some laser treatments and then some skin treatments where we're either using some skincare or doing some things like having people come in for facials, hydrofacials, really getting plumbed in with you, and then kind of tweaking their skincare along to help them meet their desired results. But that you have to, and that conversation took long just right now. So when a person is sitting in front of me and we're talking about all of those things, that's how we come up with a plan that doesn't make you look overdone. Yeah. Because we're replacing what you've lost. Right. We are not creating something totally new.
Mm-hmm. Yeah, I love that. Yeah.
And that is refinement. That is restraint. That is using our tools wisely. And that is being judicious with how we, employ all of these things that we have, these products that we have, in a way that's going to help keep someone looking beautiful, refined, natural, without going overboard.
I remember the one time we had people here, I forget what you were teaching and talking, to some of our patients. They came RSVP'd, and the cake has stuck with so many of them. Yeah. They loved it, loved it because it just makes sense.
Yeah, it does, because otherwise it just seems like face and like stuff in face, yes. Right? Like, and so when we break it, it's like anything else, right? When you break it down in parts and you're like, oh, I see why you would recommend this for a concern versus recommending something else. Mm-hmm. Or now it makes sense why you would say to do those things together and not just rely on just one tool, because it's easy to visualize that case and think of it that way.
And I think that visual is so important for patients. Mm-hmm. And I don't know, I love that. I love that. Yeah. So I do have a question.
Yes, Mia.
So eventually I would like to have a facelift.
Mm-hmm. Yeah.
And talking to a plastic surgeon,
Yeah.
he said I'd have to stop Sculptra maybe a year prior or something. Why is that?
Yeah. So Sculptra is the active part of Sculptra, something called polylactic acid, and it does act through an inflammatory process that upregulates the type 1 and type 3 collagen. And that collagen, or that neocollagenesis, happens just below the dermis. So our natural collagen lives in the dermal layer. And the collagen that we get with Sculptra, even though it's your own body making collagen, it's like in a slightly different location. And it has occurred through a process of inflammation. And so the concern is, does that create a little bit of scar tissue, or does it create a little bit of a thickened sort of surgical plane that maybe is not so like pliable, and could create a little bit of a more difficult dissection for your surgeon at the time of the facelift? Now, I've talked to a lot of different surgeons, and I always ask the question, tell me about Sculptra, tell me about Radiesse, tell me about when you would tell a patient to stop. Do you really see in your practice difficulty in a patient who's had Sculptra or a patient who's had Radiesse? Does that really pan out? Is this just something that we talk about online? Is this something that is really interesting for people to make a short video about on Instagram and it gets a lot of views? What I think most of my sort of cautious plastic surgery colleagues will tell me, anywhere from 6 to 12 months is what they'd like you to stop, just so you don't have active inflammation going on. And that most careful surgeons can do a facelift safely, even when you've had Sculptra or Radiesse in the past, and it's been applied in the correct plane and is predictably doing the job. What do you think that Sculptra is going to do? So would you want to have Sculptra and then a month later go and have surgery? No, absolutely not. But can you have a facelift even if you have had a biostimulator in the past? The answer for my surgical colleagues has always been yes. Now, I think it's important that if you've picked a surgeon, I think this is a conversation to have with them, to say, I've had Sculptra or I've had Radiesse,
right?
And at such and such a date, when would you prefer that I don't have any additional procedures done, and adhere to that? There are some surgeons who don't want you to have HA filler, because HA filler can also create a little bit of an inflammatory response. And sometimes that upregulates our collagen as well, which can be a good thing. And we generally like that. But in the face of, an impending surgery, they may not want you to have any HA filler, and they may give you some instructions, some pre-surgical instructions on that as well. So if you're planning a facelift, I would say that I would avoid biostimulators in 6 to 12 months beforehand. But I would sit down with a surgeon that I'm planning to have my procedure with, and I would ask them what their preference is, and I would strictly adhere to that. Because that surgeon, in their hands, they're going to tell you what they've had experience with, what has worked well for them, what concerns that they might have. And I think it's just really important to be incredibly transparent with your provider, for them to be transparent with you, right? We expect that as patients, but for you to also be transparent with your provider so that they know what they may also be planning for in your surgery.
Sure. Okay. Good answer. I love that. When we talk Sculptra and somebody's new to it, I hear you say you're going to do, sometimes you'll do 2 the first visit, and then you have them come back 6 weeks for the 6th.
Yeah, anywhere from 6 to 12 weeks. I find 8 weeks is kind of a sweet spot. And for me, that works out really well. I also think this works out for patients really well, because I think it's a lot to feel like you're back in the office all the time. But I do want them to get that boost in the collagen production early on.
So then after the boost, do you tell some that depend on their skin? Every 6 months to do another one, or once a year?
So for the manufacturer's instructions, they recommend, so Galderma is the company that makes Sculptra, and their recommendations are 1 vial of Sculptra per decade of life in that first year.
Oh, okay.
I don't do that always. But typically I find that based on what the patient could tolerate, and how much collagen boosting we want. Typically what I do, and also I would say in our market budget a little bit, because it does play a factor, and Sculptra can be expensive. But I usually will tell people who are older than, I would say 40, and it depends what the volume assessment looks like below 40, but 40 and above, I would expect that we're going to do 4 vials of Sculptra that first year. Okay. So 2 vials at your first visit, probably 2 vials at your second visit about 8 weeks later. And then if you love the results of your Sculptra, if you don't see results, if you hate the results, if you're just not happy with them and you never want to do Sculptra again, that's fine. You don't have to. Mm-hmm. But if you want to maintain the results of your Sculptra on an annual basis, I would probably have you come back in. Over 40, I'm probably going to do about 2 vials of Sculptra on an annual basis, just to maintain that boost in collagen and that result for you. Now, I do have some patients who are maybe a little bit more on the mature side. And so if we're using that 1 vial of Sculptra per decade per life, and we know that your fibroblast activity is probably a little bit less, and we might need to give it a little bit more stimulation, then for those patients, I say, listen, I don't know exactly what your response to Sculptra is going to be. I think you're going to have a response. I just don't know how much of a response is. But we may need to give you a booster a little bit more frequently. So I know there's like a patient that we shared that you're thinking of, and she comes to see me about every 6 months, and we do a booster treatment of Sculptra for her. And it has been a game changer. And she is so happy with her skin and her volume and how she looks, and she feels really good about herself. She is not a patient who wants an additional facelift in her life. And so we feel very comfortable in moving forward with that on a regular basis. So my more mature patients, I may use more of the Sculptra, but certainly we'll do those treatments a little bit more frequently together.
Yeah, well, she looks fabulous. But so tell me about, and I can speak from experience of having Sculptra, and I'll tell people. So when you leave, you're going to be a little swollen, but then it's going to go away, and you're going to be like, what did I do? Because you don't really see anything. But then about 2 weeks, somebody might come up and say, oh, are you getting more rest? I mean, something's about you. So what is giving them that? Because it's like a Sculptra glow. I always say like the Botox glow and the Sculptra glow.
Yeah.
What is getting that
start in the upregulation? It's that fibroblast activity kicking in. So it's that initial boost in the collagen response. And it is really pretty. And it's really nice feedback, because most patients, because you're right, like you leave here, and for a lot of my patients, so with the way that I inject Sculptra, when I first injected Sculptra, I felt like everyone looked so swollen, and I've refined my technique over time, and now people leave and I'm like, oh, like I like that much, like that extra 14 cc's in your face, like looks amazing, and they look sculpted and chiseled and like awesome, and they can leave here and go out to dinner if they wanted to.
Sure.
But you're right. In like a day or two, all that water that we injected it with is reabsorbed, and you lose that initial hit in volume. And then you have to wait for the Sculptra to do its magic, and it takes time. But 2 weeks later, you'll start to see a glow. I would say still 8 to 12 weeks, you're going to start to see a little bit of a change in your skin. That's when we do that booster treatment to really kind of just upregulate those fibroblasts even more. And then that will kind of keep you going for 12 to 18 months as the active, duration of Sculptra. And so it's not an immediate gratification. The Galderma does a really nice job. We have patients who, it's funny, we are not a practice where people really like to share their full face before and after. Some people just live in an area where it's like almost like a badge of like honor to be like shown on someone's page. It's just not the area that we live in. But we have some patients who allow us to show their results to other patients within our practice to say like, this is their journey. This is their, start their 6-month or 12-month journey. And then Galderma also has they have a couple really lovely Sculptra books that demonstrate really well how Sculptra works and how gradual it is. And so I think a lot of our patients are educated, and so they are very interested in that the natural. They like the fact that their body is doing the work for them. And so they're in it, like they're in it for the long term result, and they're not expecting that instant gratification. And so it is important to lay the groundwork and the expectation so that someone isn't disappointed, a week later when they're like, I feel like we didn't do anything.
Sure.
And so it's playing the long game for sure.
And I remember when you first started and you were doing it, and then looking at it today, I mean, like, you're on point. So I know, like, you do a lot of training, so do you owe that to that as well, like keeping up with it and knowing?
I would say thank you to Kat, who is our amazing Galderma rep, who has given me lots of opportunities to train, and Erica Berry, who showed me a lot about the way that she injects Sculptra, and all of Shinobei's work. I've seen him speak at AmSpa, have read his papers, and had a patient that I was really concerned about from a medical history, even just reached out on Instagram to him to talk about like what some of our expectations would be. Is this a good product? Should we just avoid it in general? So there are some really amazing people in the industry who have really poured into me in terms of mentorship. And then, all of the patients that I have taken care of who've allowed me to take their before and afters and really study how things have gone really well, how I can make things go even better for them in the future. And we do a lot of Sculptra here, as I think Kat could attest. In our region, we use a lot of Sculptra as a biostimulator. And what I find is that it does, again, our patient population, people want to be very, very natural. They like the fact that their body's doing the work. They like that it's gradual because they don't want other people. That's part of the, I want to see a difference, but I don't want anyone else to know.
Right.
Like that, threading the needle for them. And then also just I've gotten really good at technique, and was part of the Galderma lifting contour campaign with Countess of Shopping, who is just utterly gorgeous and an amazing person, and has done so much for the GLP-1 community. And that was really an honor to be able to do her portion of that campaign and be her injector for that, and then have her show off these amazing results. And so I think it's just, exposure to great mentors, the work that I've done over time, and then just, I do Sculptra. I mean, I would love it if I were in a practice where I just had like 10 Sculptra patients every day and we were just doing Sculptra. Like, I enjoy the process of doing it. It's an art form in and of itself. And, I really love the results that it's giving people. So, yeah.
Because, certain injectors, they're known for certain things, like, well, maybe if you want fuller lips, or something. But your jam, you're fantastic regardless, but your jam is the Sculptra, and you knock it out of the park. So, and I think everyone loves having it. And I love it too. For that reason, filler doesn't last with my metabolism. So it's using my own. So I like the biostimulators a lot better. I like some filler here and there for instant gratification, but the Sculptra over time, it definitely gives you that.
Yeah,
and
absolutely.
I attest to that. But you do
it does. It plays well. And part of I'll go back to the Galderma, the Lift and Sculpt campaign that we were a part of, which was showing that you can do Sculptra together with filler, still get a very, very beautiful result. But sometimes you need to add that. Sometimes you do need that volumizer and that structural support from the filler itself, along with the Sculptra, and it really leads to a very nice result. And then also, because the result of the Sculptra does take time, sometimes when you do a little bit of filler and you see that instant result, and then the Sculptra result develops over time, it's a nice satisfier for some patients who want to see that change a little bit. They're willing to wait for a certain amount of change, but they want to see a little bit more change. So you can do them together. I just think be judicious with that. Don't go overboard on the filler early on until you kind of see where you get to with your Sculptra.
Okay. So one last question I have is, when you're injecting the Sculptra, where are you putting it? What's safe to put it in the face as opposed to like filler versus?
Yeah. Well, no injectable filler, so biostimulator or HA filler, should go in the SMAS, so that muscular layer. no filler should go in there. So filler either goes in the fat layers of the cake. So either in like what I would call layer one. I know I have to keep that. So that top layer of the spongy cake or the bottom layer. So those are where the fat pads are. So HA filler needs to go there. Sculptra, what the fibroblasts live in that dermal layer of the skin, and they live supraperiosteally. So they live right above the bone or right by the bone. And so the places where we inject Sculptra need to be where where we want to recruit fibroblast activity. So I'm going to say in a perfect world, I would inject like intradermally or just like incredibly subdermally with Sculptra in certain areas. And sometimes I know I'm in the superficial subcutaneous tissue just because of it's difficult to just slide intradermally or like just subdermally. It's just, there's a lot of resistance there. And so, but in just subdermally or in that hypodermis, that's where you want to be with Sculptra, or supraperiosteally. So that means just above the bone. And that's where you're going to get that fibroblast activity. That's where you're going to get that upregulation in collagen production, type 1 and type 3 collagen production. So I'm not just injecting it like in the fat pad, anywhere in the fat pad layers. I want it to be in specific places in those fat pad layers. And typically you can use Sculptra all over the face. I don't inject Sculptra in the forehead. I don't inject Sculptra around the sphincter muscles. So muscles that are kind of like donut shaped muscles, those go around the eyes and around the mouth. Just because if you think of sand in a clamshell, okay, right? So the reason Sculptra doesn't go in muscles, that PLLA, one of the things I always think of crazy visuals. And so I think you know this about me, but I think of Sculptra like ping pong balls in a swimming pool, right?
Okay.
So if like when you have a small volume of fluid, those ping pong balls are nice and close together, right? If you've got a big, like a whole swimming pool, big swimming pool, then those ping pong balls get to like spread out, right?
Right.
So less likely to cause, you still can get a vascular injury with Sculptra, but the more fluid you have, the less likely that is, right? Because our ping pong balls are nice and spread apart. We get a nice diffuse treatment when our ping pong balls are spread widely apart. Higher likelihood of nodules if that PLLA is too coalescing or it's too close together. And if that PLLA molecule gets in a muscle. So if that muscle, it like contracts around that, think of sand in a clamshell, and you get a little pearl. You can get a little nodule formation if that muscle keeps contracting and coalescing or bringing that PLLA together. So we don't put it in the muscle for that reason, but around the mouth, so those sphincter muscles around the eye and around the mouth, there is a higher risk of having some nodule formation because of the way that muscle activity works there. If you get that PLLA accidentally intradermally or too close, and that muscle activity, because it's so high in those areas, just kind of moves a little bit of that PLLA intramuscularly, you can end up with a little bit of a nodule formation, and then you have to treat that. And typically, if you catch that early, then you put more water in the swimming pool. You just use a little saline and you break apart those PLLA molecules, and typically that nodule will resolve. And that ideally, you catch that early. So if you're new to Sculptra, I would say it's worth it. When I was new to Botox, I had every patient come back, right? 2 to 3 weeks. And I still do that for new patients, brand new patients, so that I learned how they did, right? And then it gave me an opportunity to make a little correction if I need to. But when you're first doing Sculptra, I would say bring patients back 10 days to 2 weeks, because if they have a little nodule formation, then you just take a little saline and you break it up. Then you don't have a bigger problem 4 months from now because you weren't checking for them, right? Or 8 weeks from now, right? When they come back in for their next treatment and they're like, I've got this bump here that won't go away, and now you're trying to break it up. Easier to do early.
Sure.
So, I think when you're learning, you can make some of those decisions to learn how your patients are recovering from this Sculptra as well, so that you can keep making refinements in your own technique.
I said that was last, but I have one more. So Radiesse being a biostimulator.
Yeah.
You do a killer jawline for people. Now, let's talk about Sculptra. Like I said, you see the swelling at first, but then it goes down. But with a Radiesse, that's a biostimulator. But man, I feel like that just snatches and it stays.
So Radiesse is a really interesting product. So Radiesse is a biostimulator. Again, it goes through a little bit of a different pathway to activate the fibroblast. And it also kind of creates a scaffolding for that collagen to kind of build upon, which is a really special quality that Radiesse has. But when you inject Radiesse, you are injecting the active part of that medication, which is calcium hydroxyapatite, and you're also injecting like a gel matrix that calcium hydroxyapatite lives in. And that gel matrix is what causes that initial lift. That gel matrix usually breaks down a little bit sooner. I would say about like 3 months or so, that calcium hydroxy or that gel matrix is kind of breaking down just a little bit. And you're left with the calcium hydroxyapatite, which is going to stimulate that. Like I said, the fibroblasts, you're going to get more collagen, and it creates this really beautiful kind of like network for the collagen to build on. With Radiesse, it's really important to educate a patient on exactly how you're using it, what they're going to experience. Typically, especially when I treat the posterior jawline, I'll tell people you're going to have, like, for the next 3 days, you're going to feel really swollen. You might even feel, and when I do a jawline on a woman, I'll tell you, you're going to feel a little bit masculine. I don't widen the jawline, but I will usually elongate the jawline or maybe drop it just a little bit lower. And I will tell people you're going to feel a little bit more masculine than you want to feel. And that jawline, just give it a couple of days, it'll start to go down. It's fine. But you have to tell people what to expect beforehand, so that they're not worried or concerned that something really went amiss in that treatment or wasn't what they wanted, right? So that's the first thing. And then with Radiesse, it's a very elastic tool. And what I mean is you can use Radiesse straight out of the syringe. You're going to get more of that gel matrix lift. And then you can also dilute Radiesse. And so whenever I'm injecting Radiesse, I add a little bit of lidocaine to it, and we'll do some struts, usually along the jawline. And then I will actually add more, either lidocaine or bacteriostatic saline to do other treatments. And sometimes I will hyper dilute Radiesse to give it more of a skin treatment and less of a lifting treatment. So now it's like a really, really thin product where we're using it for the skin benefits of it and less for the lifting benefits of it. So it just depends. The ratio of dilution is going to affect how that product can be used. But also the thing that I had a patient who I'm thinking of who absolutely loves Radiesse. And when we first did her jawline, she walked out of here feeling like $1 million. And then she came back a couple months later and was like, I don't feel like it did anything. And it was really upset. And I'm like biting my nails a little bit. I was like, I'm so sorry. I really just stick with it for a little while longer. I really think it's going to give you a beautiful result, because the biostimulatory effects of the Radiesse hadn't really, she wasn't really able to see that. And then I saw her for her next Dysport treatment, and she was like, this is amazing. So I didn't do anything between so we ran the gamut in her emotional response to her treatment, right? Sure. From the time that we did her treatment to when I saw her, to then when I saw her a couple months later, because those biostimulatory effects had a chance to kick in. And she gets a little bit of Radiesse along her jawline at fairly regular intervals. When we see things kind of changing, we go ahead and do a little bit more of a refinement, and absolutely loves it, and loves the little bit of lift she gets at first, but loves the long-lasting effects that she gets, and the changes with her skin and the changes with the tautness along her jawline, and really, really appreciates that. And so for me, I think it's just, it's very useful. I think there's nothing better than Radiesse, especially at that posterior jawline. It's one of my favorite products to pull when we really want to give someone a really, some more definition in that jawline, because they get immediate effects and those long-lasting effects that I think are really beautiful.
Well, and you have an eye for that. So someone could say something about their, I'm like, oh, it looks good. But then once you've done that, I'm like, whoa, game changer.
Yeah.
So
I think, I think focus a lot front of our face. Sure. We focus a lot, as we should. Eyes are beautiful. People focus a lot on lips. But really, truly, I think that there's a lot of beauty that comes from the height of the cheekbone, gonial angle, and then jawline. So these 3 points. When these 3 points are off, or if you're retrognathic, if your chin is too short, if this point is too high, if that highlight point on your cheek is too low, it just really reads with less beauty than if we just adjust those and refine them just a little bit. So again, it's like Sculptra. You said you could do Sculptra. I could do Sculptra all day long. I could also do chins and jawlines all day long too. I think that adds such balance to someone's overall appearance. And let's face it, we live in a time where people are having a lot of photographs taken of themselves, whether it's selfies, whether you're on a Zoom meeting, whether somebody with a camera is recording something, videoing something, taking a picture. You don't even know that they're there. And people see themselves from the sides a lot. And I don't think that we pay attention to how we look from the side until we start seeing photos and things like that. When you're in my room for an assessment, it's my job to look from the front, but it's also my job to look from the side. And so I often make these recommendations. People will come in complaining of jowls. It's happened today. Someone came in concerned about jowls. We did a lot of work on her posterior jawline, tiny little bit of work up here. She was thrilled. But it's because she didn't see herself from this angle. She realized she lost some bone and support posteriorly. We added that back in. Her jawline looked much more just attractive, and it treated that marionette because she now had that posterior support. So using Radiesse that way is a great way to just enhance that overall facial balance and everything. And facial balancing is I think that's the new trend, right?
Yeah.
Everyone's talking about facial balancing. And so again, I think if you're going into your providers, NP, PA, or MD, or RN, if you're going into their office and they're treating pieces and parts and they're not treating things as a whole, I think that's where the future of injectables and aesthetic medicine is going to, is really looking at the whole, because that is the key. The takeaway from today is the key is looking at the whole depth of our cake, right? And looking at the whole face and making sure that we're treating things so that they all flow together. That's what's going to keep things looking natural. But taking things pieces and parts is going to give you blown out cheeks or lips that just don't look like they fit your face. And so we have to keep the whole picture in mind.
And that makes so much sense. Yeah. And just the way you explain it too is fantastic. And I loved asking the questions and not being in the hot seat. So you did fantastic.
Tracie did such a good job, and I talked way too much.
No, I love it.
That's all the good things. But hopefully that gave you all some good information just about fillers, biostimulators. And I would say fillers are not the enemy.
No.
You just have to be smart in the way that you use them, making sure you diagnose, making sure there's criteria to treat, and that you're treating things in a more holistic way than treating this as pieces and parts.
Yeah, and that's what I love about you. And the way you provide for your patients, just because of that.
I think that's a lot of the really good providers that I admire and that teach me. That is, I think, just the way that people are looking at facial injectables. So you need to find a provider who's kind of approaching things that way.
Yeah.
Right. All right. Well, thank you for my Bestie and myself. And hopefully that was some good information for you and for your next treatments. And if you have any questions, definitely drop them below. And if you're still with us, maybe a little like and follow for our YouTube channel.
Yes.
Bye.